Hello, everyone. On behalf of Pharmacists Without Borders Canada, I would like to welcome you today to this webinar, which is one of a series called Cross-Country Conversations. This series, it looks at how COVID-19 pandemic is impacting our missions internationally. Today's webinar is focused on the mission in Bangladesh. My name is Linda Carrol and I live in Winnipeg, and I am the VP of Western Provinces and the webinar lead for PSF Canada. I have the honor today to be the host of this webinar and interview our mission lead from Bangladesh. Hasan is from Square Hospital Limited in Dhaka, Bangladesh, and he is a clinical pharmacist in intensive care and infectious disease. Welcome.
Thank you. Welcome to you.
Our first question today is just to get some background, is describe your healthcare setting for us.
Thank you, Linda. It's a very nice session that we'll discuss on the COVID. And before that, I am Jahidul Hasan, and I am an intensive care unit pharmacist. And I'm working in the critical care areas since 2015. It's my hospital, Square Hospitals Limited, is a tertiary care private hospital. And it has 400 patients bed, and with all types of medical specialties. And I started my journey in 2015 from the ICU department of this hospital, and I am only the Bachelor of Pharmacy and Master of Pharmacy degree when I started in the ICU department. Though the clinical pharmacy is not a very well-known topic in the country, but nowadays, over the last 7 to 8 years after working in the ICU department, now it's a little bit known to all the hospitals and the government officials that in country there is a clinical pharmacy practice in Square Hospital. So we are very proud of this, that still we have started this practice here. And this hospital is completely a private corporate hospital. So it's definitely a tough issue for our management to accommodate such a quality service like clinical pharmacy service. But after a long interval in from 2006 to 2015, our management, they started this service, and I am practicing here.
Describe your story on how you connected with PSF Canada and decided to collaboratively work on a project mission.
Okay, it's a very good story, and it's a golden story as well, that how I connected with the PSF Canada. Basically, I knew Professor Dr. Regis Valancourt, who is the Director of Pharmacy Service of Children's Hospital of Eastern Ontario. When I was struggling in my critical care areas in especially in the ICU of my hospital, because I have no one, no mentor, no supervisor, no trainer that I can get knowledge, and I can share my views and ideas. So I started to talk to him, and Dr. Regis Valancourt, he supported me, and he is the first person who communicated me with the PSF. And after that, I came to know Zain Niad, who is the first person after Dr. Regis Valancourt, and I met with her. She's a very nice lady. And after 1 year discussion, it is around 2018, in the beginning of 2018, that I started to talk to them, and they were interested in me, and I exposed them that what are my demands, my necessities, what the knowledge-based service and supports I need from PSF Canada. Is very open ground it was for me. And they were very happy, and they were interested as well to support me. And that was the beginning that PSF came to support to the clinical pharmacy development in Bangladesh. because before that I had no such an communication with any kind of global organization that I can get supports and to continue my works with efficiency and to enhance my quality of service. Then Zaim Niat came in September 2019. She visited Bangladesh for 14 days. And after that, the communication has increased a remarkable level.
Excellent. Okay. Um, how did you determine what mission purpose would be best for your organization?
Yes. Basically, I came to know about the huge plannings and mission, possible mission activities of PSF Canada when Zaim Niat came to Bangladesh. She visited our ICU and hospital settings. She found what my limitations, what are my achievements, my strengths and weak points and strong points, everything she found well. Then, after getting back to Canada, we discussed among us. Then we developed a team. Then the mission activities possible, purpose of the mission I came to know. Basically, I know that the main purpose of PSF Canada is to support and to strengthen the establishment of clinical pharmacy. Basically, in the beginning, we had a planning, after visiting Zemniad, we had a plan to strengthen our antimicrobial stewardship because it was the first one, the first antimicrobial stewardship program that was held in the country at Square Hospital. And we 4 to 5 persons who were leading this program, we needed this type of supports, and PSF Canada came to this point, and they started to support us. They planned to support us. And it's a little bit, though the two countries is not a neighbor country, it's a far away, but everything we communicate through mail, WhatsApp, we discuss among ourselves, and we come to know each other, and we plan ourselves for the future prosperity.
Okay. When did your mission start?
The mission started basically in 2019.
Okay. Okay. And how did the pandemic impact your organization and the mission?
It affected us a lot because the incidence was started in December 2019, but in Bangladesh the situation worsened in March 2020. After 2 months lockdown, April and May, the service was completely shut down. And at that time, the pandemic situation was completely stopped all the activities, business to the healthcare system. Everything was stopped. Most emergency cases, for the most emergency cases, people are moving one place to another. It's completely lockdown situation. At that time, our hospital started our COVID unit. It's a 100 beds COVID unit, separate building. So it's a big changes, and there was a big change in our hospitals. And at that time, PSF Canada and Bangladesh Mission came in a difficult situation to continue our activities. We had a plan that another expert pharmacist from PSF Canada will come to Bangladesh, and we will support us in the antimicrobial stewardship program. But the tour was cancelled. The program was stopped, and we just communicated ourselves with the virtual meetings. Some Zoom meetings was there. So as the situation was declining, and I entered into the COVID unit as a frontline clinical pharmacist. So I was busy at that time. But we, after 3 to 4 months, we came again, and our activities get started little day by day. And in from October to 2020, we strengthened our activities through the virtual meetings, and we added some interactive sessions as well. Nowadays, it's completely virtual, and we are going well among us, though the pandemic is not getting over.
Excellent. Yeah. Yeah. You guys have pivoted really well in the middle of chaos. So you've done a great job. How many people are involved in the mission um, in your organization, and what are their tasks?
Okay. Basically, I'm the lead from Bangladesh side of this program, and I am leading. I'm communicating with the PSF Canada, basically Zoom and other team members as well. From my side, I have my supervisor and my senior in charge, Professor Dr. Shita Chandra. He is the consultant of our pharmacy department, and he is serving our pharmacy department from the inception of the hospital. So he knows a lot. He knows the beginning and the current situation as well. So we have taken Professor Shita with us as he is a very experienced and very potential person. So he's with us in the front line, and other 13 pharmacists we have, though they are not directly involved with the PSF Canada Bangladesh Act program, but they are supporting me that whenever we are taking some interactive sessions, they give the questions, they give the topics, they give the suggestions, how can we build ourselves, though the support is all for us, but we and with all other pharmacists, we in our pharmacy department, we are trying to strengthen this program day by day. And that's why everyone is trying for this establishment of this program and the future development of this program.
Excellent. What would you say have been some of the successes of the mission so far?
Yes, it's a very, we passed a very dangerous situation, serious situations that pandemic COVID-19 has stopped every activities. But success, we planned many things, but we haven't able to accomplish these things. But we are trying to resolving these complexities and doing something in future. But we have into the the 2019 we have just started this program, and after that we had two interactive sessions including all the pharmacists on the patient counseling topic. That was very helpful for our pharmacist, which is the main goal of this program. And every pharmacist can participated there in two webinars in November, one in ending of November and another one is in the beginning of the December 2020. In both this program, every pharmacist of our pharmacy department participated well. They learned a lot of things. They have reported to the department. Our human resource department also knew these things, that we have trying to enhance our quality of service. That is a very, very important part and goal of PSF Canada and Bangladesh program. So during the COVID situation, we are trying to getting some successes as possible over virtual access.
Excellent. What lessons have been learned to improve mission process for the future?
Yes, definitely we have planned to strengthen our communication activities, supporting programs day by day. But I have learned that PSF Canada is such an organization that can first identify the facts, the points of care, then they provide the supports. This is an excellent way of supporting others like us from a setup with lots of limitations. So PSF Canada, from PSF Canada Bangladesh project, I have learned that for the future, in our future missions, we have to uh, strengthen our collaborations through some effective sessions. Like we have 14 pharmacists in total, that the development of all these pharmacists in their particular field of skills is highly necessary. So PSF Canada can provide virtual some training programs for them, that they can get knowledge and some attachment with some expert, so they can improve their activities. these are the primary plan, and I have learned that this might be a very helpful things. Another one is that some observational trainings that like me and other pharmacists are depriving a lot. So this is not possible at this time during this pandemic situation, but we think that this might be very helpful, and hopefully in the next year we might have these types of programs successfully. But these are the mainly the learnings, that collaboration and supportings, that every day we learn and we communicate to PSF, and we are establishing our activities, we are establishing our qualities. These are the main learning points I found from PSF Canada and Bangladesh mission.
Excellent. Okay.
Thank you.
So last question, what would your ultimate goal or dream be for this project? What would you like to see as the ending?
Yes, sky is the limit.
Sky, yeah.
I think PSF can, yes, definitely. Because Zahid, I like quality service for the patients, for the healthcare professionals to whom I will give my supports. And PSF Canada Bangladesh Mission is the a big program that is not, we are just passing some difficult situations, but hope in nearest future we will develop some training programs for our pharmacists, and we expect some trainers from PSF Canada who will visit Bangladesh. They will see our setups, our administrations, our facilities. Then they will provide some suggestions, some tools, some access that pharmacists, local pharmacists can improve themselves. Not only in my hospital, it's a very overpopulation, highly dense populated country Bangladesh is. So lots of private and public hospitals are there. So Square may be an ideal, maybe an standard one. So this services should be available in other hospitals. So PSF Canada now working with the Square Hospital, but I think once it will work too many hospitals in the country, then they will, all the pharmacists, a mass number of pharmacists will get supports from PSF Canada. Now we are just initiating the processes, the pathways. So definitely my hospital is expecting more and more from PSF Canada, and we are very open to contribute in PSF Canada programs as well, from administration to clinicians to everyone. So I think it would be a very remarkable support that PSF Canada is providing to us, and future the support will be strengthened and will be increased a lot, we think.
That's awesome. That sounds great. Well, thank you very much today for your time and sharing your experiences with us. And we really appreciate it. And all of our viewers, I'm sure, will be very interested and appreciate it as well. So on behalf of PSF Canada, thank you so much for sharing, taking some time today to do this. And take care, for the best and all the best in 2021.
Thank you. Thank you, Linda.
Okay.
Thank you. Bye.